Our project was on congenital sucrase isomaltase disorder. It is a rare genetic disorder that affects a person's ability to digest sucrose and maltose. Only 0.2% of the North American population have this disorder, which means they are unable to break down these sugars within their body due to the lack of the sucrase and isomaltase enzymes.
CSID is an autosomal recessive genetic trait on chromosome 3. The allele is altered between regions 25 and 26 on the long arm of the chromosome. This alteration causes a deficiency or complete absence of sucrase and isomaltase enzymes. The sucrase isomaltase enzyme complex is found in the microvilli within the small intestine and breaks down sugars and certain products of starch digestion, such as dextrins. The absence of the enzyme complex causes sucrose and starch products to not be absorbed efficiently in the small intestine. Some people with CSID may experience nausea, vomiting, or reflux-like symptoms as a result of the disorder. The three main symptoms of CSID are explosive diarrhea, abdominal distension, aka swelling, and abdominal discomfort. Some children may also experience malnutrition due to the malabsorption of essential nutrients or failure to thrive due to nutritional deficiencies. Infants can also be irritable, colicky, or have abrasions or irritation on their skin from prolonged diarrheal episodes. Symptoms have a more severe effect on infants and young children rather than adults because their diets consist of more carbohydrates and their initial digestion is faster than that of adults. A telling sign of CSID is if these symptoms occur soon after consuming sucrose or maltose, which are both commonly found in modified milk formulas, fruits, and starches.
There are no outside risk factors. For example, the environment does not cause CSID. Since it is a genetically inherited disorder, if two people who have the chromosomal abnormality have children, their genetic makeup increases the risk of passing the trait to their children.
For example, if two carrier parents reproduce, there is a 25% chance their children will not inherit the gene, a 50% chance their children will be carriers like they are, and a 25% chance their children will inherit the disorder. If two parents with a recessive genotype reproduce, there is a 100% chance their children will inherit the disorder from them. One last example is if a carrier parent reproduces with a recessive parent, the children will have a 50-50 chance of either inheriting the disorder or becoming a carrier of the gene.
There are three common treatments for CSID. First, you can try modifying your diet to reduce the amount of sucrose and maltose that you are consuming. Although this can be very difficult, a low sucrose diet would help to make you feel better. Another treatment would be to use a prescription oral solution called saccharisidase. This FDA-approved drug is a yeast-based enzyme that replaces sucrase, which is usually produced in the body. Since the body can't digest sucrose with this disease, this enzyme will help digest and absorb sucrose instead. If these two treatments don't aid in relief, it is time to see a professional dietitian. They will help you look over different meal plans and help you understand what types of nutrients are in different types of foods. This will educate you on what the best options are specific to your health and diet. Each person with CSID has a different amount of the digestive enzymes, sucrase and isomaltase, so when it comes to dietary needs, each individual is going to have a different tolerance to different types of food. People with CSID can work with a dietitian to develop a food log to keep track of these types and amounts of certain foods eaten, as well as the reaction to said food. The best way to determine which foods the body will be able to tolerate is by trial. Before comfortably consuming any food, it is important to determine individual tolerance.
As CSID has an effect on the number of enzymes that break down carbohydrates, the greatest difference between a CSID diet and a regular diet is carbohydrate consumption. The best way to determine carbohydrate tolerance is to start with sucrose, also known as table sugar. Table sugar is refined and often used as an additive in many sweetened foods. It is best to next move to non-grain-based starches such as potatoes or other starchy vegetables. Lastly, grain-based diet starches can be introduced. Grain-based starches move the slowest through the digestive tract, allowing for more time to digest these foods. By determining tolerance in this order, the individual is able to determine tolerance based more on enzymatic activity rather than duration of digestion. One easy change for a CSID-friendly diet is going from refined white rice to quinoa. Most people with CSID can consume plain proteins, meaning no sauces, seasonings, or breading. Many seasonings and sauces contain sugar and starch fillers. Butter, oil, salt, and pepper are less likely to produce symptoms. It is also recommended to avoid processed meats like bacon or deli meat, as they are often cured with sucrose or contain starch fillers. As for meatless forms of protein, beans and legumes are good sources of proteins but are also starchier foods, but can be introduced once starch tolerance is determined. Tofu is a good option that is also lower in starch. One easy change for a CSID-friendly diet is going from cured sausage to unbreaded chicken. Most individuals with CSID are able to consume most fats and oils. However, it is recommended to read nutrition labels to determine potential sucrose and starch content. With other dietary restrictions, it can be difficult to consume enough calories, so one way to consume a sufficient amount is by eating full-fat dairy products. Processed dairy products should be avoided as they often contain sucrose or starch fillers. One easy change for a CSID-friendly diet is going from Velveeta cheese to sharp cheddar cheese. There are other ways to better the digestion of starches while eating. One way is by chewing starchy foods for longer. This breaks down the food while allowing salivary amylase to act on the starch for longer while the food is in the mouth before entering the gastrointestinal tract. Another way to increase starch digestion is by eating foods high in starch along with foods high in fat. The fat will slow the rate at which the foods move through the small intestine, giving more time to digest the starches as they move through and become exposed to pancreatic amylase, isomaltase, and maltase.
Even though this disease is hereditary and no environmental factors contribute to the contraction of the disease, with proper treatment and management of the diet, people with CSID can live an overall normal life.